This is how I went from underachiever to finally getting accepted into CRNA school. Hi, I'm Zeus. I'm a practicing CRNA, and today I'm going to dive into a question that I commonly get. How did I make it into CRNA school? Before I get into it, if you're interested in seeing more content about becoming a CRNA, please like, subscribe, and leave a comment below. Be sure to turn on your notifications so you know when I post a new video. So going back to my early college days, I really didn't know what I wanted to do, and I was floundering. I didn't have any big dreams of being a CRNA at this point. I was just content with barely passing my classes, getting by, and having fun. And my grades definitely showed that. I was a very mediocre student. At this time, my mom was a nurse, and she'd always encouraged me to take up nursing, because as a nurse, you'd have a stable job, you'd always have a job, and it's a respectable profession where you get the opportunity to help people every day. But I wasn't on board with that idea. I kept on telling myself, I'm going to find my own way. I just had no clue what that looked like. And I was really going nowhere. So while taking classes in college, I also worked at Chipotle. And I remember one shift as we were closing the restaurant, I was washing the last set of dishes, and I thought to myself, what is my life going to look like 5, 10, 15 years down the road? And I remember feeling afraid that I was going to be stuck doing something that I didn't want to do, discontent with my life. So I knew I had to start getting intentional. I had to stop bouncing around and just finally commit to something. So I decided to take my mom's advice and I would pursue nursing. So I moved back home and I started taking classes at my local community college for nursing prerequisites. Around the same time, I also got my certificate to become a nursing assistant, and I started working in an oncology unit. I worked on this oncology unit for about a year, and it was my job as a nursing assistant to help patients with their basic needs, like hygiene, bathing, eating, even things as simple as getting out of bed and walking down the hall. This was very physically demanding work. I remember leaving a 12-hour shift exhausted. All I would want to do is go home, shower, and fall on my bed. But till this day, this was one of the most rewarding experiences I've had. Patients would be on this unit anywhere from a few days to a few weeks receiving cancer treatment. And I had the opportunity to know them very well. And it was through this experience that I learned a lot about resilience and empathy. So when it finally came time to apply to nursing school, I had to choose between getting my associate's degree in nursing or my bachelor's degree in nursing. And I had some insight from working on that oncology unit. I could see that hospitals were pushing for more bachelor's prepared nurses. And if I ever wanted to pursue some type of advanced practice nursing role, like nurse practitioner or CRNA in the future, I would need that bachelor's. So that was the direction I decided to go. And thankfully, I made it into the first program I applied to, which was an accelerated Bachelor's of Science in Nursing program that lasted 16 months. Now, getting into nursing school was a big deal for me, but at this point, I still didn't know how to be a successful student. And while I made it through the program, I graduated, my GPA was nothing to brag about. By the end of nursing school, my GPA was a 2.9. Instead of trying my best in my classes, I was content with just getting by and getting my degree in hand. It's one of those things that I still kick myself for till this day. If I had known how much further I would want to go, I would have tried so much harder to lay down a stronger foundation for myself. But at this point, I still didn't have any plans for any type of advanced practice. It just wasn't on my radar yet. Well, I graduated and I was on my way to work my first job as a registered nurse. And that was in the operating room as a circulating nurse. It was my job as a circulating nurse to basically make sure that surgery happened and happened safely. I would check consents, make sure that surgeons had the correct equipment they needed for the correct procedure, that surgical technicians had all the instruments they needed, and that a sterile field was maintained all along the way. I was excited for this job. It felt like a whole new world had opened up to me. This was also the time that I had my first opportunity to watch CRNAs in action at the head of the bed. Before this point, All I knew was that CRNAs were advanced practice nurses that provided anesthesia, but I had no idea what all their role entailed. I watched these CRNAs manage difficult airways, give all types of medications, administer nerve blocks, handle all kinds of emergencies. But what I was most impressed with was their expertise and knowledge base. Now, it didn't take long before I started to envision myself in their role. I wanted to know what it would be like to take care of patients in that way. I started asking them all types of questions. How did they handle these types of emergencies? What were these medications for? And eventually, I gained enough courage to ask them, how do I become a CRNA one day? And their answer to me was clear and straightforward. They explained to me that it takes hours upon hours of hands-on experience managing complex patients and responding to emergencies in the ICU to prepare you for the demands of anesthesia. And it's this foundation that allows them to step up confidently to high-pressure moments at the head of the bed. If I was going to make this dream of becoming a CRNA a reality, I would have to start by getting into an ICU. So on one shift during my lunch break, I walked to the ICU, I found the manager's office, and I introduced myself. I said, "Hi, I'm Zeus. I'm a new graduate nurse, and I currently work in the operating room, but I'd love the opportunity to work in the ICU." They didn't have an open position for me that day, but 4 months later, I would finally get my chance. Now, working in the ICU, that was a game changer. I was working night shifts, taking care of the sickest patients. I took care of patients that had undergone open heart surgery, liver transplants, traumas, patients on ECMO. The experience challenged me in so many different ways, but I knew I was exactly where I needed to be to one day apply to CRNA school. But still, I knew my GPA was holding me back. After all, I had graduated nursing school with a GPA of 2.9, and that wasn't anywhere close to cutting it for one day applying to CRNA school. So I looked back at my transcripts and found the classes I had done poorly in, and I made the decision to go back and retake these classes. I started with Chemistry 1 and Chemistry 2, and I remember sitting in that classroom looking at the periodic table, thinking, I wouldn't be spending my time doing this right now if I had just tried harder and done my best the first time around. But that didn't matter. All I could do was humble myself and focus on my current goal. After retaking Chemistry 1 and Chemistry 2, I retook Anatomy and Physiology. I retook Statistics. I also took an organic chemistry course. And it made all the difference in the world to care about what I was learning. Along with retaking classes, I also got my CCRN certification. That's the Critical Care Registered Nurse certification. This is a requirement for most CRNA schools, but not all. But I knew I would need this in order to prove to an admission committee that I was a competent critical care nurse and that I was dedicated to this path. I also took the GRE. I spent 3 months studying for this test, and I scored well. Overall, I spent 3 years in the ICU, and looking back, that experience laid a foundation for so many of the things I would do later on in my career. And when it came time to start applying to CRNA programs, I knew my GPA was still going to be a red flag, even after retaking all these classes and getting A's the second time around. I was well aware that I was competing against other highly experienced ICU nurses with perfect GPAs and spotless academic records. But still, I believed I had done the work necessary to prove that I was ready for CRNA school. I applied to 3 programs, one in Florida, one in Arizona, and one in Texas. I got 2 responses back quickly. They were rejections. This was a tough pill for me to swallow. After all the years spent in the ICU, the hard work retaking classes, it felt like a setback. But I had to remind myself that this was a marathon and not a sprint. And on one day, on a camping trip with my girlfriend at the time, who's now my wife, I got an email that said I was invited for an interview to the school I had applied to in Texas. I was beyond excited. This was my opportunity to show them who I was beyond my transcripts and my test scores. I spent several weeks preparing for this interview. I read my ICU textbooks, brushed up on pharmacology and physiology. I practiced answering all types of interview questions, everything from clinical scenarios in the ICU to questions about my own personal motivations. I even bought a new suit for the occasion. I wanted to be prepared and walk confidently into that room and ready to make my case for why I belonged in their program. When it finally came time to interview, I was nervous. I sat in that room with two faculty members from the university sitting across from me, and the questions started coming. They asked me everything from basic chemistry to symptoms of electrolyte balance disorders, ventilator management, arterial blood gas interpretation, and with each answer I was giving, my confidence just started slipping away. But as long as I was in this interview, I knew I had to keep my head up and just answer each question to the best of my ability. At one point during the interview, the faculty members looked at me, and I'll never forget what they told me. They said, "Your scores do not impress us." At that moment, I felt my heart sink. Then they followed it up with this question: "Why do you belong in this program?" My response to them was this: "You're right, my scores aren't impressive. When I was younger, I didn't take school seriously. I was complacent and I procrastinated. But I've spent the last few years trying to improve myself as a student, and I believe that I have what it takes to succeed in this program. And if I'm not accepted this year, I would continue to retake classes, continue to gain valuable experience in the ICU, and they would see my application again next year." And I think this is what they wanted to hear, because they decided to take a chance on me. I made it into CRNA school. This was a dream come true for me. And this time, I would not waste the opportunity. When I started the program, I threw myself completely into my studies, and I was fueled by a genuine passion for what I was learning. Even before classes began, I researched the best study techniques. I sought out the best resources. I learned how to absorb information quickly and efficiently, and that's absolutely necessary for anyone wanting to go to CRNA school. And that preparation paid off. In the 3 years of my doctoral program, I made all A's with the exception of one B that was in my first semester. While grades aren't a true measure of your skills as a clinician or an anesthesia provider, for me, it was a personal victory. I had proved to myself that I had what it takes to succeed academically. So what's the key takeaway from all of this? If you're someone like me, someone who didn't have a perfect GPA, someone who didn't know what they wanted to do right away, and now you have big dreams of achieving something meaningful, don't let those early missteps define you. Instead, own them, learn from them, and use them as fuel. If you're willing to put in the work, and I mean really willing to put in the work, you can make it happen. And I'm proof of that. If you're currently in the thick of your ICU experience, or you're thinking about retaking classes, I promise you it's worth it. Remember, it's not about being perfect, it's about being willing to keep on going. Thank you so much for watching today's video. Let me know what you think about it in the comments below. If you're interested in seeing a day in the life of a CRNA, be sure to click on the link in the description. Thank you guys.